Hey guys, it's your girl Tasha. Welcome back to Love My Me, the channel where we discuss all things health and wellness, and we run the gamut from traditional treatments to holistic. So today we got another video in our sinus series, and we're talking about the antihistamines. You guys know them as the medications that you see over the counter, like Claritin, Allegra, Zyrtec, Zysol. I don't know if a lot of people know about this one or use this one, but it's kind of one of the newcomers. To me, it's been around a while, but it's kind of one of the newcomers. But people take these medications on a daily basis to help with allergy symptoms. And if you're here watching this video, then you're probably an allergy sufferer or somebody that you love is suffering from allergies and you're just trying to figure this thing out. But I got to remind you before we move on, hit the thumbs up, subscribe to my channel, and type some comments below and just let me know what's going on with your allergies, what's worked for you, what doesn't work, and I'll respond. All right, so back to the allergy medicines. These class of medications are called antihistamines. And in the stores, you'll see the brand names. I got the brand because what everybody's used to. But you'll have the generic name, like Walgreens might have Walfed or something like that. Walmart has the Equate brand. CVS has their brand. Whatever store you're in, they'll have the generic brand, but the chemical of the generic brand is the same that's in the branded name. So the generic for Claritin, the name is loratadine. So that's the chemical that you're going to see. That's the medication name that you're going to see on the back. That's the generic name. For Allegra, the name is fexofenadine. So you'll see fexofenadine on the back of the generic and the Allegra box. For Zyrtec, cetirizine is the generic name that you'll see on the back of this box and the generic store brands. And then for Zysol, levocetirizine is the name that you'll see on the Zysol box, on the back of the Zysol box, and in your generic brands. I don't know if there's a store brand for levocetirizine. If it is, if you picked it up, let me know. I'm familiar with all of these medications because at work I prescribe them. But before you take these medications, I just want to kind of give you an overview and let you know the pros and the cons, okay? So, pros, they help with allergy symptoms. So if you've got runny eyes, those itchy ears, runny nose, itchy throat, sneezing, you're just miserable because of the spring season, the pollen, and the allergy symptoms, they do help with those symptoms. And some people will find that one particular medication works better over another. Or if you've been suffering for a long time and you've been taking, for instance, Claritin for a long time or loratadine for a long time, you may find that it's no longer effective and you may have to switch to another medication like a cetirizine or a fexofenadine, okay? So the pros are that they do help with those symptoms. Some of the cons are during the allergy season or during the time of year when you are having the most problems, you will have to take them every day. So nobody likes to feel like they need to take a pill every single day. So that's one of the drawbacks. So these also are in the same category as Benadryl. And if you've taken Benadryl, you know that Benadryl is notorious for causing drowsiness. but these are second generation antihistamines. Benadryl is a first generation antihistamine. So it's been around forever, years. So they came up with these guys to decrease the drowsiness and the problems that people were having staying awake and keeping a sharp mind and sharp focus. So that's the benefit of these type of medications versus Benadryl. If you have an allergy problems and you want to go to sleep, at night, then Benadryl is going to be your go-to. But these are not supposed to have drowsiness attached to it. But some people are sensitive and do respond with drowsiness to these medications. So the biggest thing about these medications that shocked me, y'all, as somebody who's treated patients with allergies and suffered from allergies for years, I never really got into taking the medications. I've taken them a couple of times. Claritin, it works. But I was shocked to find out the side effects. And some of the side effects that I was seeing, particularly in my patients in the office, in some of the groups that I'm on the internet for allergy moms. My son has had severe eczema, so I'm in a lot of moms groups, allergy groups online. And particularly with kids, grown-ups too, they have a lot of mood changes with these medications. It doesn't happen often, I would say, but it's often enough to where people online are talking about it and studies have been done about it. So before you give your kids, and there's kids versions of all these medications, but before you give your kids or you yourself take this medication, let's talk about some of the common side effects that you could potentially experience while taking these medications. And we've all seen the commercials and we know they run down the list of side effects, but I've seen these side effects enough in some of my patients, enough to know that it could be a little bit of a problem. So I just made my list because I just can't remember everything. So let me put on my glasses here and let's go over some of the common side effects. Okay, these are the side effects that the drug companies kind of expect to happen when you're taking the medication. So, common side effects: nasopharyngitis, which is basically a cold, irritation, inflammation of the nose and the sinuses and everything. Somnolence, which somnolence is you basically sleepy and difficult to wake up. Fatigue, diarrhea, fever, vomiting, dry mouth and mucous membranes, cough, ear infections, sore throat, nosebleeds, urinary retention, which leads to urinary tract infection. If you're retaining your urine and you don't pee, basically, bacteria builds up and you end up with a UTI, then you got another problem. Physical weakness, headache, and muscle aches. So those are some of the common side effects that we expect to see when taking these medications. All right. Now, let's talk about the serious side effects. And these are the ones that stick out to me that I've seen, particularly in some of my adult patients. I've seen the side effects happen with people that I've been in contact with online and in my allergy groups. So, hallucinations, psychosis, anxiety, aggression. These are the ones that also night terrors. So these are the ones that are particularly troubling for children. Some adults, I've had some patients that have had serious night terrors on certain classes of these medications, and once we stopped them, then they went away. So hallucinations, anxiety, psychosis, aggression. So you have to watch for this in your children when you give them the children's version. If they start having personality changes and they just become completely different, then you want to think it's the medication that you're giving them. Other serious side effects are headaches, skin eruptions or rashes, suicidal ideation, guys, seizures, syncope, which is passing out, allergic reaction or anaphylaxis, liver damage, low platelets, which is called thrombocytopenia. And what happens in thrombocytopenia is your platelets drop and you start to see little spontaneous bruises or bleeding. And we did discuss nosebleeds. So, and also something called hemolytic anemia, which is destruction of your red blood cells. So, if you're thinking about taking any one of these medications, you want to be on the lookout for these serious side effects. Things like, liver toxicity, low platelets, suicidal ideation. If you're not the one taking the medication, and even if you are the one taking the medication, you might not be aware of those things until something dramatic happens, particularly the low platelets, hemolytic anemia, and the liver toxicity. You're going to end up going to your doctor thinking something's wrong. And a lot of times, these things are not traced back to the medications you're taking. So, but the thing that shocked me the most was the personality changes, the mood disturbances, the aggression, and the suicidal ideation. So I just want to give you guys some caution on this. Proceed, watch. For the majority of people, they work really well, and I've seen that. It was just very shocking to me to find out about and see the actual side effects that were so severe for treating something that can be considered a mild issue like allergies. So I want y'all to check out my video on natural antihistamines. I'll be going over a few natural antihistamines that you can take just like this, just like anything else. Everything is to be done in moderations, but go over and check out my video on natural antihistamines, okay? And give me some feedback in the comments on what you've seen, what you've experienced, if you've experienced anything with any of these medications. And hit the thumbs up button, subscribe, and stay tuned for more videos. Peace, y'all.